Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Dr. Regina Koepp. Good morning.
Morning.
And so Dr. Koepp is with the Center for Mental Health and Aging, and so we're super excited to have you on the show today. And probably we're a little more excited to have you on the show today because we're going to talk about dementia and sex. And so, the things that people don't want to talk about, we're going to talk about today. And so, so I have to ask, you're a doctor, and this seems to be more your specialty. Is that correct? What made this a particular interest for you?
Yeah, I'll just clarify. I'm a clinical psychologist, so I'm not a physician. And I specialize with older adults and families. I worked for many years, more than a decade, in an outpatient mental health clinic for older adults. And I worked a lot with older couples where one member of the relationship did not have dementia and one member of the relationship did, where there might be caregivers for siblings who might be living in long-term care or living in the home, adult children caring for older adults with dementia. And so often the question would arise in my clinical practice around aging and sexual health, but then when it came to dementia, how to navigate sexuality in the context of dementia. And it was a very common question that not a lot of people had resources and answers for. And I, at the time, simultaneously was very involved in ethics. So I was on ethics committees in the hospital or medical center I was a part of. I was a member of the Georgia Psychological Association Ethics Committee and became the vice chair of that ethics committee. And we would help our constituents and help the hospital or medical center I was a part of navigate ethical dilemmas as they arrived. And with dementia and sexual health, there are lots of ethical dilemmas that arise, namely that how do we protect and honor a person's dignity and rights as they relate to sexual expression and balance that with our duty to protect when people are vulnerable. And so that's the sort of hallmark ethical dilemma when it comes to dementia and sexual health. And I wanted to wrap my head around that and have some resources for people.
I think most people don't realize that that they should be having the conversation more than they think they should. So one of my clients had come in and one of her parents was in memory care, and he was in memory. He didn't know who anybody was anymore, but he had a girlfriend. And so, and ironically enough, the family was really, really okay with that. And my first question was, how's the other person's family? And she said, oh, they're actually doing very well with it as well, because they're just more than making sure that they're happy, just want them to be happy, And so, so while the conversation of them actually having sex never came up, how often does it occur? And I guess the question, you're like, oh no, we're having a hard time with this question. Is it good for them? Basically, is it? I would think it'd still be good for them no matter what age. But in the context of dementia, I guess the rational part of my brain says, yes, they should be able to do that. And so, but I'm curious to see, with all your research and everything, how do you have the conversation with people about it?
Yeah. So you're asking a few questions. One, how common is it? Two, how frequently should we be having this conversation, and so on. So let me back up a little bit and just give some basic understanding of sexual health among older adults, because dementia is an illness that predominantly occurs in older adulthood. Some people earlier in life do have a dementia disorder, but it's more prominent in older adulthood. So I think it's important to look first at how frequently are just older adults in general engaging in sexuality or sexual expression. And so there was a study done in 2021, not my study, but there was a study done in 2021 that was published in the Clinical Gerontologist, I believe, or the Clinical Geropsychologist. I can't remember all the names of the journals. It was a peer-reviewed journal, and it surveyed 1,000 adults between 65 and 80 years old. And it found that among those older adults between 65 and 80, more than 50% of men and more than 30% of women report being sexually active. Sexual activity included intimacy with a partner or masturbation. And I'll just say also, for the purpose of this episode, we are talking about sex. And so if it's not the right day for people, and because we'll probably be talking about consent, I just want to be sure that people are also consenting to watching this as well. And we'll be talking about sex, and I'll be using sex terms. So just heads up about that. But it could be with a partner, or it could be with self-stimulation and masturbation. But that's the majority. More than 80% of adults between 65 and 80 are engaging in sexual activity. So when we look at adults with dementia, so of course research gets more complicated when it comes to adults with dementia. There's a group out of Kansas City that does a lot of research in long-term care communities surrounding sexual health and long-term care. And that's where we can find more adults with dementia able to not necessarily engage in research themselves, but the researchers survey the long-term care communities, the staff there, and they ask the staff, how frequently are the adults living in your memory care, or the adults living in your long-term care with cognitive impairment? How often are you seeing sex acts or verbal sex talk or romance or intimacy? And what their research shows is, study after study, that in sexual health and sexuality and sexual expression exists in nearly every nursing home nationwide, or long-term care community nationwide. And to the rates where sex acts are occurring and sex talk is occurring in more than 85% of long-term care communities. And so it's a pretty common thing. And of course, this is the whole wide range of sexual expression and intimacy, from holding hands and cuddling to intercourse. So that's one thing. The recommendation is that we talk with older adults about sex. So back to your question, I think part of your question was, how should we be talking about sex with people? So there's older adults in general, and then there are people living with dementia. And that's two different populations. Right. When we look at older adults in general, we know that actually people are not talking with older adults in general about sex, even though more than 80% are sexually active. And so when older adults are going to their doctor, their doctors say not bringing up the questions about sexual health, and even their physical primary care doctor. In fact, the majority of older adults say that nobody talks with them about sex at all, in terms of professionals, and that when the conversation is had, it's only had about 17% of the older adults in that survey that I mentioned. 17% of those folks say that they talk with their doctor about sex. Only 17%. And then the study also asked, well, who brought it up? Who brought up the topic? And 60% of the time, it's the older adult bringing up the topic. So older adults aren't asked, but older adults are engaging in sexual health. And here's why it's so important that we start having these conversations. That's older adults in general. Because in the last 20 years, STDs like gonorrhea, syphilis, and chlamydia have doubled among adults 65 and older. So we have to be talking about this among older adult groups, also because this is a population that didn't have access to sex health education, might not know how to use a condom, might not know about lubrication. I mean, I'm sure they know about lubrication, but might not know about some of the risks like skin tears and lubricants and how they can be helpful, how to use a condom, why reducing risk is important, how to reduce risk, and so on. And so those are some reasons we need to be talking about sex. And also because we know that sexual health is good for mental health and physical health and is part of health. So then if we look at adults with dementia, if the general older adult is not being spoken with about sexual health and how to optimize sexual health while aging, we know that even fewer adults living with dementia are engaging in that conversation. So the recommendation is that when people move into a long-term care community or even into a family home, and I'll share an example in a minute, that a sexual health intake is part of the intake process when a person moves into long-term care. And so that, like, if we imagine if a resident moves into, it becomes a roommate with another resident, and the new incoming resident enjoys sleeping in the buff, enjoys sleeping naked, and their roommate is very private and not very comfortable with nudity, right? And those two people get paired, it might not go very well. Or if one person is, it might sort of rub against their value system. And that's just one small way that even learning about the idiosyncrasies about a person's sexual health will help even in a long-term care setting. So then you asked, I'll stop there and see what your thoughts are so far.
Well, I guess the first thing that came to mind when you were talking about it, is there a list of questions they should be asking, and do y'all provide those? Because, before that, I kept thinking I could never have the conversation about sex with my grandparents, because I was their caregiver, and made provisions for caregiving, things like that. I'm thinking, man, those are the last two people I would have had a conversation with about sex. I'm not even sure I would have had the conversation with my mother.
And they might not wanted to have that conversation with you. But this is where a professional is really helpful. So these sexual health conversations, if they can't happen in the context of a medical appointment or with nurses or with physicians or with a psychologist, where can they happen? Because those are places where these conversations would naturally exist. If we even think about therapy, which is what I do with people, or consultation, therapy is one of the most intimate settings that a person can imagine, or physical health, right? If you're going in and you're getting into a gown, that's a very intimate experience. And if you can't talk about sexual health in these private, protected, HIPAA protected environments where your privacy is protected by law, like, where can you even have these conversations safely? And I'll say too, adult children and older adults don't always share the same values around sexual health. I've worked with many older adults who are much more progressive in their own sexuality than their adult children, and their adult children aren't willing to accommodate what their needs are when the older person moves in with them, and vice versa. There are times when adult children are more progressive sexually than their older parents, and people are different. And that's the key, is that just because people are in the same family doesn't mean they'll have the same value system or sexual belief system or desires. Yeah.
So, it's one thing to, for adult who doesn't have any cognitive, issues to talk about sex and how they feel about it and preference, just the things you would have conversation wise. But how does it differ? And what are the challenges when talking to someone about these things when they do have dementia? Because I think that, for me, it seems like it'd be a lot harder to have that conversation.
Yeah, it is. I'll also just back up and say, I think you made an important point when you said I would really struggle to have this conversation with my grandparents. And I think this is part of also a barrier in health systems and mental health systems, is that I'm a 46-year-old woman myself right now. So if I am engaging in a conversation with an 86-year-old couple or an 86-year-old man, the 86-year-old person might say, like, well, what do you know? You're 46. Like, this, you're at a very different stage of life. And then as a 46-year-old or even younger, as I supervise lots of people in their late 20s, early 30s, if a 30-year-old or a 27-year-old is asking a much older adult about their sex life, it can be very uncomfortable, because it fractures the rules that we have about respecting our elders, and you're old enough to be my grandparent. Should I really be asking you this? And so it creates a lot of barriers in the clinical room. But I would say we have to address the barriers and still do it anyway, and do it in a way that's respectful. And to your question about, are there questions that people can ask, and how do we even have these conversations? The recommendations are that these conversations are had in health spaces. And also between trusted loved ones. I mean, if you're a partner and you want to have these conversations with your partner, great, have at it. But there's a toolkit that is created by nurses called the PLISSIT. It's PLISSIT. It stands for permission. It's an acronym about how to have these conversations. And it gives some suggestions on what phrases to use when asking about sexual health. And they're very direct. I have a more fluid approach to asking questions. I'll ask about relationships. Then I'll ask, for many older adults, intimacy and sexuality are very important. Is that important to you? And then go from there and ask questions. So I normalize that sexuality at any age is important. And then we go from there and ask, is that important to you? If they say yes, I ask, would you like to talk about that? And can I ask you some questions? If they say yes, then I do. If they say no, then I don't. And so there's, it just is a sort of more fluid process. The PLISSIT, that tool that I mentioned, you can Google it and find it online. That has more directive questions, and it's really designed for healthcare spaces. But there's a lot of research using that tool that shows that in different types of settings, from palliative care settings to dementia care settings, that's a very effective tool to use. Yeah.
Good. It's always nice to have something you can look at without having to look. So,
yeah. Go ahead.
Well, I'm grateful that I'm an attorney and I can get to ask different questions. I will tell you that. And so, but no, we've had conversations, with clients that because their parents have been, in memory care, and they now have a girlfriend or a boyfriend, and for me, I think it's fantastic, so, and that's the kind of conversation that we have that, it says, well, it's great. How do you feel about it? Or usually I ask, how do you feel about it before I tell them how great it is? Because you want them to feel good about them having somebody to care about and someone to care about them, because I think that's so important, because one of the things that we tell clients all the time is, men that have been married for a long time tend to remarry quickly if they lose their wives, because I think that companionship and that, that taking care of and that closeness that you have, tends to be more predominant in men than, necessarily than in women, we find. And so, but yeah, I am grateful that I don't have to have a lot of those, conversations, but, it has come up, ironically enough, in the estate planning, arena, of, what do we do, and you want to make sure, from us, I look at, what does the facility say? And, and how about the other family? Because now we're talking about two people that don't have, capacity, how do you navigate, that kind of thing. And so are there more challenges and risk when you're talking to someone? And if so, how do we ease into that and make that easier for the people, either the caregivers or, the family, to make it easier to have these kind of conversations and steer people to a place of being able to enjoy life safely, and to do the things so that they're not, we want them in the right place to have it. We don't want them in the common areas, to kind of make sure that they're directed in, at least in privacy and things like that. So how do you talk to people about that?
Yeah, you're mentioning a lot that I want to sort of tackle piece by piece. At the start of what you were talking about, you were describing capacity, and there's a question often in the context of dementia and intimacy is, does the person have the capacity to consent to intimacy? So I'll say that is one of the risks that does arise around dementia and intimacy. You were also saying at the very beginning of what you mentioned, you were saying, and yet I want people to engage in intimacy because there's a comfort, there's a sense of connection and belonging. Also, if they're living in long-term care or memory care, there's a sense of home, there's a sense of purpose, potentially. There's a sense of, this is maybe the last place I'm going to live in my life, and can I make it meaningful and rich for myself, and how beautiful, and we want that for people. And people have rights, even in the context of dementia. People with dementia have rights, including the right to sexual expression. So how do we honor that? And then you brought up the role of the family. And oftentimes family members, when there is a big change in a person living with dementia who lacks capacity, family members are involved. And that doesn't mean always that the family member has the right to dictate whether the person can be intimate with somebody else or not. And so the long-term care community might also have the right to override and act in the best interest of the resident. So it gets very complicated. And so I will say that it can help for families to know. One is, how do you have these conversations? You have to get educated. You have to, and tune in also to your own values, because we all have our own values coming into this world of sexuality. And so one is to get educated about, what does capacity even mean? Because what a lot of people and professionals and family members struggle with is this concept that capacity is not generalizable. So what that means is, if a person lacks capacity to manage their money, lacks capacity, they can no longer drive a car, they can no longer manage their money, they can no longer live independently, that doesn't mean that they automatically cannot consent to intimacy. So just because you lose capacity in one area of your life doesn't mean you've lost capacity in all areas of your life. And so it gets very tricky, though, with dementia, because then it comes down to, well, then how do we determine capacity to consent? Because that's a very different process than capacity to drive a car. And because here's what the kicker is, that with sexuality, unlike driving a car, unlike managing finances, unlike living independently, sexuality, if you think of Maslow's hierarchy, sexuality is at the very base, along with eating and excretion. And it's also in the middle with relationships. And so if you're driving a car or managing money, that's like at the very top, right? And so you can't remove a basic need, like to masturbate. But to your point, you can't masturbate in public. And so, right? And so how do you do it privately? I thought I heard you say also. So so there are questions, so the first for family members and staff is critical to get educated. What is expected for older adults in general? I think we have a lot of myths and stereotypes about aging and sexual health in general, and then what's expected in dementia. And then there are lots of stereotypes and myths about and misinformation about dementia and rights and dementia and ability. So those are a couple of things, just to get educated. The other is, like I mentioned, to check in with your own value system. Your value system may be very different than the person you're caring for. Your sexuality may be very different than the person you're caring for. I've worked with older adults who have come out, who were always in opposite sex relationships and are starting same-sex relationships, and their adult children are appalled, right? That maybe their adult children are religiously conservative and the older adult is not, or was and is shedding that part of their life. That people with dementia are also entitled to change, just like you and I are entitled to change. And so there are all these sort of layers that are value-based that we also need to be mindful of and paying attention to. I'll also say that it's tricky, because even if somebody does engage in so if there is a question about, can your loved one consent to intimacy, there is a process for, there is a consent evaluation process. And so sometimes that's more extensive than others. And if your loved one lives in a long-term care community, my hope is that every long-term care community has a sexual health policy that says that we expect that our residents will engage in intimate relationships because they're human, and that's what humans do, especially when they live in close quarters. And just because they have dementia doesn't mean that they don't desire or need intimacy or relationships. A person can also maybe not consent to intimacy, but could consent to hand holding and kissing. And so, there's a spectrum of intimacy that a person could or could not consent to. And that needs to be thought through very thoughtfully with, I think, professionals who do this all the time. So, but a sexual health policy can help with that. And the sexual health policy can also point to guidelines, like what do we do when, say one person, so this is also very common. Perhaps one person in a long-term care community is hypersexual, which is not the same thing as consenting to intimacy, but maybe because of dementia, their brain is not able to regulate impulses and emotions like it once was. And maybe they're pursuing for intimacy all over the place and they're hypersexual. And it actually is causing problems in the long-term care community. But this is not uncommon. I think in 2 to 8% of long-term care communities, this does happen. And so I've consulted on cases where maybe there was a resident who was hypersexual and they were pursuing for intimacy with other residents, and the other residents maybe physically couldn't move away. And so staff have to be very involved to help other residents get to a secure place and then move the resident who might be hypersexual, or work with the medical team to figure that out as well. And so that's a risk with dementia and sexual health as well. It's not just simply can the person consent or not. That's a big, big one. It's also, can the person regulate their impulses in the context of dementia? Is that possible? Can they understand if the person is saying no? Can they understand what types of intimacy they're okay with, but not other types of intimacy? Can they communicate that to their sex partner? So these are all sort of questions that arise in the context of dementia. Also, do they misidentify each other for a spouse? Like, do they think, oh, this is my spouse, and so I'm going to be intimate with this person, but maybe it's not their spouse, or likely not their spouse. And is that okay? And so there are a lot of questions that need, I think, professional guidance rather than just knee-jerk reactions and our own values guiding us, because that's not sufficient, I think, when it comes to dementia care.
Perfect. This has been fantastic. And so, Dr. Koepp, how does someone find you if they want to get some more information on this important topic?
Yeah. So my company, the Center for Mental Health and Aging, you can find at mentalhealthandaging.com. You can also email me at regina@cmhaging.com. I just wrapped up I offer a 15-hour continuing education certification program in dementia and sexual health. And so we just wrapped that up on Wednesday, actually. So that's an intensive, comprehensive program about dementia and sexual health. And so I offer that a couple of times a year.
Perfect. And so thank you so much for being on the show. In spite of the topic, it is one we have to talk about, because more of our seniors are aging, and a lot of them are not aging well. And so making sure that they're healthy and happy in all aspects of their life, I think, is really important.
Yeah. And sexuality and sexual health is part of humanity and health overall.
Definitely. And so it's good to have you. Thank you.
Thank you.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.